Hello, my name is Christopher Bilodeau. I'm a nurse practitioner in family medicine and I practice over at Tri-River Health Center, and that's in Uxbridge, Massachusetts, United States. I've been a nurse practitioner now going on 15 years, and the primary population in which I see used to be family. I used to see kids all the way until the elderly years. However, right now I'm mostly seeing just adults. There definitely is a lot involved as far as family dynamics, and there are a couple instances which, I've gotten involved in cases where it's really helped to get the family involved. I think every single time we go to work, part of what we do is not only treat the patient, but treat the whole family dynamic. There are people from a simple phone call from somebody in the family who's calling for an appointment, that's making an appointment for a family member, all the way until somebody that recently called the office and this gentleman was saying that he wanted to end his life. He was talking about taking a lot of medications and slicing his wrist, and he was by himself. So I think, from a particular outcome standpoint, we actually got the family involved. I was the nurse practitioner working urgent care that day, and the nurse was on the phone with this gentleman. The nurse spoke for a great length of time, keeping him on the phone, primarily just to see, if he has any support, what is going on in assessing the situation. As a nurse practitioner, my job obviously is to advocate for the safety of the patient. It was decided that it was probably an unsafe situation and we weren't sure what was going to happen, so I called the police. But I also got in touch with the patient's wife, and in this typical case, HIPAA, which is sort of their privacy, when somebody's actively suicidal, it's important to protect the patient. So I ended up speaking to the wife and got the wife involved. The wife inevitably went home. The police showed up, and by getting involved with the wife and getting involved with the authorities, he got the help he needed. He's admitted to the hospital. He did well, and we sort of got involved in a very key, important moment in this gentleman's life. That's a situation where, looking from a crisis standpoint, those are things that we are expected to do as nurse practitioners, nurses, physicians, nurse practitioners. That's part of our job. Looking forward as to another situation where the family is involved. I can think of a child actually that I saw. This was a patient that was probably around, when I saw this patient, it was 7 or 8 years old, but this child actually had Tourette syndrome and obsessive compulsive disorder going back when he was, I think it was around 3 or 4 years old, where the pediatrician sort of suspected it, and I had seen this patient over and over during the time. This is a difficult situation because this particular patient was a child. This child needed family intervention. This child, they started this child with medication, and he did okay for a little while, but it didn't really do anything for his Tourette's. What it really did was sort of blunt his personality and calm down some of the worries that he called it, the worries. But it was only a small piece of medicine. Only takes you so far. Medicine is, pills do so much, but in the end of the day, pills really, they especially for something for psychiatric disorders, I think you need to really get involved with pills and counseling. In this particular case, the family needed to be treated and needed to be involved. He had a brother, and he had 2 parents that were completely confused. He had a history of anxiety in the family, but there was no Tourette syndrome in the family. So in this particular case, what we did, which I think is incredibly important, was not only did we get the child cognitive behavioral therapy, not only did we get the child involved with a counselor, but we also brought the family in and educated the family about anxiety disorders, Tourette syndrome, its link with obsessive compulsive disorder, and sort of taught the family not only how to accept what's going on with him, but also to do things that he's practicing. The counselor had him practice certain measures like, chewing gum or breathing exercises, or doing certain things in the height of anxiety to help calm down some of the tics and the Tourette's and the obsessive thoughts. Rather than, not teaching the family these things, we got the family involved. And what happened was the family started to learn to recognize some of these things. And when the child started to show anxiety and started to do things like, getting really anxious and started to act out, it wasn't because he was being bad, it was because he was really anxious and scared. So the family would sit down and say, okay, let's chew some gum, let's work together here in this. And the brother and the family all got together and worked as one, and this intervention really made a huge difference. And I think we don't see enough of that, especially in this fast-paced day and age of medicine, where everything is 15 minutes, bill, 15 minutes, bill. Oh, to get a psych problem, let's send it to psych. We got a problem with gastroenterology, send it to GI. That doesn't really do anything. I mean, it does solve diagnoses at times, but there are so many complicated cases that require a lot more intervention from the family. Whether it be the crisis I spoke about earlier with the gentleman that was actively suicidal, or whether it was something like a child who is facing a diagnosis that can be quite scary. The family get involved in both ways. And I think that these are two examples that I can just think of now, but over the years of experience in doing this, I can think of probably a lot more, but I don't have enough time to tell you about all those. So I think it's important to understand that our roles as nurse practitioners doesn't stop at the patient. It stops, it kind of extends beyond those doors into the family dynamic. And I think that's what makes you successful, if you can kind of bring everything together. And I think it's sort of what makes us a little bit different as well. There are a lot of good providers out there, but I think nurse practitioners have a great understanding of what we need to do as providers to sort of bridge that gap. And I'm doing this for 15 years, and hopefully I'll be doing a lot more, and I do enjoy it. So whoever's watching this video, thanks.